What's up, everybody? Welcome back to the Move Better channel. I am your host, Dr. Joe, and this is Matt. Today, we're gonna be talking about knee pain and some dysfunctions that you guys might be having. Now, most knee pain doesn't necessarily start from the knee. The cause of it is elsewhere. Most of the time, it's above or below. And today, we're gonna give you guys some tips and tools that might be able to help you assess and examine where the problem might be coming from. And if you fix those areas, you may be able to alleviate your knee pain. So today, let's start going into some of the assessments that we normally check to see if it's a hip problem or an ankle problem. And be sure to tune into some of the exercises on another video that may be able to help. So if it's a hip problem, check out the videos on another exercise that it will be able to fix your hip. If it's an ankle problem, be sure to check out the ankle exercises that may be able to fix your knee. So to start, what I want you guys to do all at home is to sit in an area where your feet are somewhat dangling off of a bench or a table. And so that way you could see some of the range of motion tests that we examine. So Matt, let me have you sit back a little bit further so that way, there you go. So the back of your knees are pressed against the table here, and you have a 90-degree angle from the hip, the knee, and the ankle. So what I'm going to have him do is I'm going to get a block right here. You guys can just use a towel, you guys can use a book, anything that's going to help keep your hips in alignment with your knee. Okay, so your hips and his knee is pretty straight here. And then from here, I'm just going to test to see if he has proper internal rotation. So Matt, I'm just going to have you bring this ankle out here, and we're just going to assess to see, can he bring it out? Now, some people can't even bring it out this far. We're looking for about roughly a 40 to 45 degree angle in this from his knee and his ankle for internal rotation. And then for this side, I want you to go ahead and bring his shin across and over and to see if he has range of motion there. Now, for us clinicians, we're a little bit more picky about what we want to see. But for you guys are just trying to figure out how to fix your knee pain. You're just trying to assess side to side and see what the dysfunction is. So notice his knee, his knee and his ankle are at this angle right here. Go ahead and drop that down. And we're just going to switch sides and see if he has a dysfunction from side to side. He has proper internal rotation there. And look at the difference in this angle here. He's struggling to get his hip into an external rotation here. Notice the knee and the ankle is different from this side compared to this side. And so that's a lot easier to do on this side. Go ahead and drop that down. And you're going to notice it too. You're going to feel the differences. You're going to feel the dysfunction. Go ahead and bring that ankle over there. And notice he can barely get it up over his ankle without him starting to shake. Go ahead and relax. So I'm going to get you guys at the edge of a table on one side. Again, his feet are going to be dangling. Now I'm going to have you move off to get his closer towards the tailbone and his butt at the edge of the bed, table, whatever you guys are utilizing to assess. Now we're going to do something here called the Thomas test. We're going to check to see how much extension he has from the hip and the knee. And so here I'm going to have him grab his left knee just for camera purposes. He's going to hold his knee nice and tight against his chest here, and he's going to lay straight back and down with his head down on the ground. Now notice as he pulls his knees into his chest here, his knee starts to rise off of the table. So as I slightly create pressure into his knee here, notice my hand can slide underneath that, right? And if my hand can slide underneath the table here, there's a lot of space. Now, some people can't even get their knee all the way down, and that's when we have a hip dysfunction, what we have a psoas dysfunction. We're testing specific muscles that are too tight within that hip complex. The psoas is one of those muscles, the TFL, the rectus femoris, which is a quadricep muscle. Now notice his leg kind of sits out. It doesn't necessarily sit at a 90-degree angle here. We have a hip dysfunction, a hip tightness in this area, and we have a quad muscle that goes from the hip. It's a hip flexor as well as a knee extender, and it's a muscle that starts from the hip joint, goes past the knee and down into the shin right over here. And that muscle on Matt right over here is already dysfunctional. It's already tight. So that might be one of the main causes of knee dysfunction. As you can see, it's not at the joint that we have the problem, it's a higher. So that's one of the areas that we want to fix. So if you have this dysfunction and you have tested it and you notice that you can't put the back of your hamstring down flat against it, you probably want to do some hip mobility, hip flexibility exercises to relieve pressure within that knee. So another view that I want to check is I want to see if what we call Faber is a flexion, external rotation, and abduction of the hip. We want to see if his knee can reach where I want it to check. And in my case, I'm just going to see if I have a fist and a thumb length away, can his knee reach to my fist over here? And in this case, I'm trying to push his hip over on this side, and I want to see if he has the proper angle of what we call the external rotation, abduction, and flexion of that hip. Now, that looked normal on that side, and then I want to grab his leg, and I want to just see if I can get an internal rotation. Go ahead and bring your foot out towards me over here. And so in flexion, he has the range of motion. He's not hiking his hip over here on this side here, and he looks pretty good on that range of motion. Now, on this side, we're going to be testing the same thing, and we're going to see if our test holds true from when he was in a seated position. Now, can he bring his knee down into that same position? And notice he cannot. So that proves our point that he has a problem with his hip external rotation on his left-hand side. And that's something that we're going to want to fix if he has the knee pain on that side as well. So hips, we want to make sure that the hips are nice and mobile, and we want to make sure that we retrain that mobility so that way it decreases the amount of workload that the knee has to do for the hip. And so on our next videos, we want to check, I want you guys to look and see how we're going to be able to create that control, that flexibility, that mobility of that hip so that we can relieve pressure off of that knee. When a person has knee problems, it could be coming from above or below the joint. And so when we assess as clinicians, we want to see where the problem could be lying. It could be from the ankle. It could actually be the shin, or what we call the tibia, and rotation. The knee does rotate. It doesn't just flex extend. It has some rotational aspects to it as well. So one of the things that you want to test is see where the shin is actually moving. So you're going to feel your patella or your kneecap, and you're just going to go down and inferior, and you're going to feel that thick bone on your shin that kind of protrudes underneath your knee. When you do that, you're going to assess one side at a time. You're just going to see if you have rotation there. And simply put, notice my hips in alignment with my ankles. They're all straight. I'm going to place pressure. I'm going to just press on that tib, and I'm just going to lift my foot and feel that tib rotate as I move my foot in and out without moving my knee. So one of the things that you could possibly do is put a pillow between your knees or two fists and just see if you have range of motion for internal and external rotation of that ankle shin complex. Now notice when I rotate my foot outward, I can feel my shin start to rotate outward as well. And then if I rotate inward, I could start to feel that shin slightly rotate as well. And so that's what you want to check first to see, could it be below the knee that's causing some of that dysfunction? And be sure to check our other videos to see how you can fix mobility below the knee. Now, one of the other things that I also start to check is, what if it's the ankle and the foot complex? Now, if I want to check range of motion and assess those ankles and see how much control I have over them, remember the ankle is a very mobile joint, so it should have a lot of range. It should have a lot of control. It's not just something where we do a dorsiflexion or a plantar flexion. It works on internal, external rotation. It works on supination where it comes up, or pronation where your arch starts to collapse. It also works on seeing how the arch actually creates pressure by working on your metatarsals, by lifting your toes up and seeing how much control you have over your big toe, and to see if you actually start to create an arch in your foot. Biggest ways for me to test all of those is, simply put, I want to see, can I lift my big toe and still push my metatarsal bone into the floor? And that's the ball of the foot. If you scroll into that, that's this part of the foot right in here as I lift my big toe. Now, a lot of people can't do this. It's a hard move to create. Now, push your toes, your four toes into the floor. And as I push those toes, lift your big toe. And how high can you push that while putting pressure onto that ball of the foot. That's test number 1 for the foot. Number 2, I want to see, can I keep my knuckles in between my knees, and can I lift the mid part of my foot? Then can I put that part down and lift the outside part of my foot without necessarily breaking the position of my knees? So can I lift the outside part? That's going to be more of a pronation and an inversion, whereas the other side is going to be more of a supination and eversion of my foot. Then can I internally rotate my foot without moving my knees? And can I externally rotate my foot without moving my knees? And then test it from side to side. How much control do you have from each side, and which side is more dysfunctional? Now, could it still be below your knees? What if you worked on both? If you worked on both of them, if you worked on both sides and allowed them to kind of create a function or a mobility control over the area, then most likely your knee pain could go away. To get more out of it, you definitely want to get assessed by a professional, physical therapist, chiropractor, clinician, anybody that knows and understands mobility and movement. Now remember, you guys, knee pain is normally the source of the pain, where the cause is elsewhere in the body. It could be coming from the hip, or it could be coming from the ankle. Now, if you notice with these assessments that your hip is the one that's dysfunctional, make sure that you click on the link up here to be able to work on some hip mobility exercises that may be able to help alleviate that knee pain. Now, if it's the ankle that you found dysfunctional, make sure you guys click over here, and that way you guys can find out some exercises that you could do for the ankle and maybe alleviate some of that pain for the knee. Make sure that you like, subscribe, comment below, share with some of your friends or family, and let us know how we can better help you guys with some of your knee pain that you guys might be dealing with. Thanks again for joining us, you guys. We'll see you guys on the next video.